Hello, my name is Monica Mulligan, and today I will be discussing leukemia. My presentation will go over the etiology and risk factors of leukemia, what cells, tissues, organs, and organ systems are affected by leukemia, signs and symptoms, treatment plans, prevention techniques, and short and long-term consequences of the disease. Unfortunately, the cause of leukemia is unknown. It is said to be a combination of genetic and environmental factors, but there is some insight through the development of leukemia. It is a cancer of the blood, most often the white blood cells, and as we know, white blood cells are crucial to our body's ability to fight off infection. Many leukemia patients do not die from the cancer itself, but from other infections that the body cannot fight off, or complications. So while we do not know the exact cause, there are some risk factors associated with leukemia. I have listed here smoking, genetic disorders, exposure to chemicals such as benzene, previous cancer treatments, and a family history of the disease. It is a very tricky disease to predict, as some patients may have all risk factors associated with leukemia, and some may have none. Leukemia is classified in two different ways. The rate of the disease progression, which gives it the acute or chronic title. Acute leukemia involves mutated blood cells that divide and multiply very quickly. These cells cannot do what they're supposed to do because of genetic malfunctions and grow very rapidly. Chronic leukemia is when the white blood cells are either overproduced or underproduced. These cells can potentially function normally for months or even years before they become detrimental to someone's health. The other way leukemia is classified is by the type of white blood cell that is affected. Lymphocytic leukemia affects the lymphoid cells, which make up our immune system, and myelogenous leukemia affects the myeloid cells, which consist of red blood cells, white blood cells, and platelet-producing cells. Leukemia forms within the bone in the bone marrow, which you can see in the center of the picture. Now, healthy blood cells only reproduce when there's room for them. Blood cells that have leukemia reproduce regardless of room. Once they can no longer fit within the bone, they overflow, and that is when symptoms of leukemia will become present. So acute leukemia patients have rapid growing cells that overflow much quicker than chronic leukemia patients who have slower progressing cancer cells. The first organ system I will talk about that is affected by leukemia is the circulatory system. This is the most obvious as it is blood that goes through our body, and leukemia is cancer of the blood. I like this picture because it shows the organs of the body too. And with leukemia, once the mutated blood cells overflow into circulation, they can end up anywhere and tamper with any organ. As the mutated cells work their way through the body, they severely hamper distribution of oxygen, nutrients, and immune cells. And obviously, the less of these going around, the higher risk of infection you have. The next organ system I will discuss that is affected by leukemia is the lymphatic system. Bone marrow is part of the lymphatic system, so it is obviously affected. But also, as I talked about in a previous slide, some types of leukemia target lymphoid cells. This system is basically our immune system, and once it is compromised, we are susceptible to infections and illness. But really, all organ systems can be affected by leukemia or complications of leukemia. When I say complications, I mean the infections I mentioned earlier that are what usually cause death for leukemia patients. As our immune systems are suppressed and the mutated cells make their way around our bodies, we are subject to any infection and illness. Patients can develop pneumonia, colds, and many other infections that their compromised immune system just can't fight off like a healthy immune system would be able to. As we now know, once leukemia symptoms are present, it means that it is in your blood and out of the bone marrow. Some symptoms include swollen lymph nodes, fevers and chills, excessive sweating, including night sweats, frequent nosebleeds, infections that won't go away or keep coming back. easily bleeding or bruising, bone and joint pain, red spots on the skin, and losing weight without trying. Now that we just covered organ systems that are affected, these symptoms make a lot of sense. However, most people don't do research projects on leukemia, and these symptoms are pretty vague and could apply to many different problems. On top of that, some symptoms that occur with leukemia are due to other conditions that develop because someone has leukemia. Things like anemia, leukopenia, which is low white blood cell count, thrombocytopenia, which is low platelet count, or an enlarged liver or spleen. The blood cell counts are obvious because healthy cell production is hindered by the cancer cells overrunning them, and the enlarged organs make patients feel fuller than they are, which can explain the unintended weight loss. The four main treatment plans for leukemia patients are stem cell transplants, chemotherapy, radiation therapy, and immunotherapy. Patients may have a plan that uses one or multiple treatment options. Chemotherapy is one of the main forms of treatment to kill cancer cells. Chemotherapy may be received orally, topically, through injections, intravenously, or by direct placement. It essentially works by preventing cell growth. Some stem cell transplants work by either taking the patient's healthy stem cells prior to other treatment and freezing them until they're needed, or receiving donated stem cells from anyone that's a match. This is usually performed after another treatment option to help rebuild the cells and immune system damaged during other treatment. Radiation therapy is the other main form of treatment to kill cancer cells. It can be received on the skin over the affected area by placing radioactive material directly in a tumor or the area around it, by swallowing a pill form, or by injection. And immunotherapy stimulates the body's immune system to fight the cancer cells, or provides antibodies to fight the cancer cells. Since the exact cause of leukemia isn't known, it is hard to prevent. Limiting the risk factors that you can limit is a good start. Not smoking and being aware of what you're being exposed to in risky situations, or really as often as you can. Also, leading a healthy lifestyle is a good idea. Once again, not smoking, maintaining a healthy exercise program, and eating healthy foods are all good examples. If anything, this will give your body a better starting point if you do get leukemia. The healthier you are when diagnosed, the stronger and easier it will be for your body to fight it. All treatments discussed earlier are very taxing on the body and have their own set of side effects, most commonly known as hair loss, nausea, and fatigue. This poses some short-term consequences for leukemia patients, and of course, not all patients that are diagnosed go through treatment survive. Unfortunately, death is a long-term consequence of the disease. I've been touched personally by this, as my best friend and sister-in-law was diagnosed with leukemia when she was 30. It was a very traumatic and hard time for the whole family. I was away in the military, so I didn't get to see the day-to-days of her treatment, but I would have given anything to be home for her more than I was able. It is important for patients to have a strong outlook, but it is also important for patients to accept that they might not make it. There was never any talk of my sister-in-law not making it, so about a year after her diagnosis, when she ultimately passed away due to complications of the disease, it was even more difficult for everyone, including my brother and their 3 children. The reality of it is that this is a brutal disease and not everyone will survive it. But science is an amazing thing, and hopefully one day cancer will be a thing of the past. Thanks for listening. I hope you learned a lot and enjoyed my presentation.